scrubs, and then she goes over to shower, and then she showers.
And then once you shower, of course, we won't be doing any procedures at this time. When you will cross over through the scrub room and out of the doctor's lounge room and showering. So you won't cross back over on the side.
What do you do with your scrubs?
They're trashed.
Go in.
Yeah, will not launder anything. Now me, I'm watching her. You remember, I've got my garb on. I'm going to, if she had to sit down, you know, we might be to the point where they're exhausted and dehydrated, they might have to sit down. Then I'm behind her. This is why I'm going to have full garb on too, in all reality. I'm going to come through, I'm going to roll this up, I'm going to get it all to where it's going to be thrown away, and I'm going to disinfect her, wipe that chair down with a wipe.
Should be the cleanup coming behind.
Yep, I'm going to clean it behind. Unless I'm the person that's going into the room next. So, and that's it in a nutshell.
Any questions?
And you will make mistakes gowning and gloving. It's very hard, especially taking it all off. But the thing is, you just exercise it and wipe as soon as you can, because the sooner you wipe that off, the bleach, bleach will kill people. So.
And there are a couple steps that if you are, you know, a trained eye and you're watching this stuff come off, like when you take that apron and you pull it until that plastic breaks, there go a bazillion spores. Or you pull this, or you take those gloves and pull them off, bazillion spores. So, you know, in all reality, the person that is watching her take it off does need to be just as protected as Tammy coming out of the nursing home.
And technically, they'll probably stand out in the hallway at the door and watch, because that room is not big. And we don't have an ideal situation here, but I don't think anybody does. But the further, at least if you can stay about 3 feet back, you're a little more protected. But you still need all that garb on just in case, because I may not be able to get something off, so she may have to help me get something off.
Or she might have bioburden on her back and she can't reach it or see it, and I'm gonna be the one cleaning up the bioburden.
So for your inner shoes, are you using like rubber boots or just whatever you got on?
I have a pair of, they're called slogs. I got them years ago for surgery, and they're an autoclavable, wipeable shoe. I just don't wear them for surgery anymore because the arch is out of them, but they would work.
But you know, we had all the,
But you aren't gonna use it in the autoclave. I mean,
No, but they're
It would have to go in
wipeable.
the trash,
They're
am I
wipeable.
correct? Oh.
They're wipeable.
No, I would use them again,
Yeah,
to
she'd
go back
have to
in the
use them
room,
again.
but we would wipe them off.
Right, and we would keep them in that area where we're taking off the dirty stuff. They would remain in the dirty. They wouldn't, and when, if and when this would happen, she would never get them back. They'd go to the landfill.
Yeah.
So,
But, and right now, I don't know where we sit, but if we had a patient, we could have them up to a couple days before they can get out of here, because it is not guaranteed they will go to the University of Nebraska. University of Nebraska they hire a 10-bin unit. They won't have 10 patients ever. They said the most they take is probably 4, because of just the resources it would take to take care of the patient. So, you know, it has to be a confirmed case of Ebola before somebody would take them. So we would have to get the blood sample, we'll get it sent, have it confirmed. And the test only takes 6 hours.
6 hours, but we have to get the sample. We have to get someone to curry it down to Omaha. We have to have it tested, and we have to have a positive confirmation, and then we can start the process of getting transferred. So we have the potential of having this person here for 48 to 72 hours in all reality.
And whoever would take them, they'd send their own team to get them.
I think Midwest Medical is gonna transport those patients. The last meeting we had, which has been a month ago, they were getting the training to do that, because your ambulance is out of service for 30 days after you use it. It has to be completely torn apart and disinfected, so.
there's 36 hospitals in the United States that are designated as like Ebola treatment hospitals. I mean, they can take Ebola patients. The only one in Nebraska is the Med Center and the biocontainment unit. So,
They ask for volunteers, no one stepped in.
Yeah, they asked for regional hospitals if they would take Ebola patients, and not one hospital would.
You can't blame them.
I think the resources and the money, because like all these places like the Center of the University of Nebraska, nobody's paying the bill.
and what was it? What'd you say it was? Billions or millions
Yeah,
or?
For one person.
It's
Yes.
like over $1 million.
It's over $1 million for the one person. And that's been a long time ago.
Yes.
I read that, and it's like nobody's paying.
I know the plan on North Cloud, anything that goes into that room, computers, we take a ventilator in, which probably won't be intubating these
Not
patients.
here.
You know, IV pumps, anything that goes in that room is gone.
Yep, it's trash.
Yep.
And the
You'll go
treat,
through and incinerate.
the treatment pretty much is lots of
Yep.
fluids. And if you're lucky enough to get the vaccine that hasn't been approved yet, it's in testing. And then the other thing they've been doing is receiving blood or plasma from someone that had survived Ebola. And they don't know to what degree that helps, but those are the three things. Those are the three things they've
And
been doing.
if we have a suspected patient, we will of course take all of that scope equipment out of the room before we put that patient in contact.
So where would we hold them prior to?
Hopefully in a wheelchair in the hallway. I mean,
We have no.
And just plastic them off?
Yeah, we have no optimal place to keep them on them. We can't leave them out in there, we can't keep them on the carpet. They'll probably be sitting in the hallway in a wheelchair, not to contaminate. We don't wanna put them on an ER cart, cause then we have to fry our ER
Right.
cart, you know? In all reality, they're gonna have to sit in a wheelchair.
But would we go ahead and plastic, you know?
Oh, absolutely.
well, I mean, we probably would
Contain
have
it
them
that
on
way.
plastic and just get everything out of there and
As
then.
quickly as we could.
But you remember, it passes through body fluids.
So, I mean,
Anybody, correct?
well, it's more virulent in sputum and vomit. In the late stages, it will be in tears, but,
Sperm,
yeah.
But we really hope we don't have them here that long, because we're worried about the tears. We pray.
Which, I mean, honestly, the saving grace for me is the fact that first patient they did have in Texas, it was all over their hospital and nobody else got it.
Yeah.
Yeah, I mean, he projectile puked in the ambulance and the paramedics didn't get it, so, I mean, I think
but you can't be careless either.
you got to
No.
use your precautions, but you just, and I felt bad for those nurses in Texas, they had no training besides.
Well, they had no I mean, nobody, how can anybody be prepared for
Yeah,
something like that? You don't have any idea, but they got heck for it.
Mm.
But if you put any hospital, except like the med center
The
that's built for
biocontainment.
that, yes. So I felt bad for
But
them.
if that guy would've just walked in there and they didn't have any idea, he probably would've worked out the same way. Because they wouldn't have just started out saying, well, he's been over there, he's got Ebola. He'd have sat in there waiting around to go.
Well, he did the
He
first
did.
time.
He was in the ER twice.
Well, I'm talking about the med center, it wouldn't have been any different if
Yeah.
we went there.
Well, and they did a thing on the med center where they've had some scares and what they do for ER to isolate that patient, so it's pretty interesting. They have this back hallway with 2 rooms, and they throw them in there, and they plastic everything off until they get the test back, so,
Which is
Well-
right next to their trauma base, because I know that from the other time.
yeah.
And
So,
where
I
is
mean, they
this
don't have an
plastic
ideal-
that we have?
Because they're
Plastic is
always-
downstairs.
Okay.
So the kits and everything will be up here to start with. And the plastic, everything related to the Ebola, the PPE and the plastic and everything is in a set area downstairs. It's not
all
like,
one size fit all,
it's not like strung all over.
like the Tyvek suits, and that's all one size.
Yeah, but I have to.
Or are they gonna have different sizes?
All one size?
Yeah,
Yes.
like I'm a pretty big guy.
Well-
Sometimes getting into some of that stuff for me is, it's like slipping on small gloves.
We can try that. I think it's an extra large. Because you can always, on these suits too, I mean, like if you've got somebody tiny and it's like big and it's in the way or something,
Tape it
I
up.
mean, you can always tape it.
And that was my question, I mean, it's an extra step, but should we be taping that zipper?
We did that on one of them,
And I kept
And we-
hitting my
yeah,
chin
she
when I
kept
put
hitting her
it,
chin.
yeah.
and then when she tried to get it unzipped, we couldn't get it unzipped because the tape stuck. We did that on one of those.
Yeah.
It was a disaster.
Well, I think you have more of a risk of infecting
Yeah.
or exposing
Right.
yourself than,
And the zipper, doesn't come down, I mean,
Yeah, because we did that on the very first one, Vince, and it was not a good thing.
because I was like, I can't see.
And then, yeah, and then it kept poking her in the chin, and she kept reaching up and grabbing it, and, it was a bad thing.
Yeah, but it will be very hot. And it will be very hard to do anything on that patient with 3 pairs of gloves on, drawing blood, starting IVs, but it is what it
It is
is.
what it is.
any questions? Because we don't have all the answers either. I mean, it's a plan as to the room and what we're gonna do, but I mean, if it actually, I mean, there's always something that comes up when it happens, so we get it together. But we do just the best we can. Thank you.
So
We will use our